every eye deserves the best. क्या आप भी मेरी ही तरह दूर का देखने और पढ़ने में स्ट्रगल करते हो? Well, turns out 30% of world population is seeing similar vision issues. और हो भी क्यों ना, let's be honest, most of our time is spent on digital screens, be it working, binge watching, or scrolling mindlessly. And that's exactly why I am meeting Dr. Rupal Shah at Center for Sight, global name in the world of eye care. She has done over 1 lakh LASIK surgeries, mentored to thousands of surgeons worldwide, the woman who pioneered smile surgery not just in India but in the world. आज हम क्लैरिटी लेकर ही जाएंगे. क्या आप एलिजिबल है एक आई सर्जरी के लिए? What are the latest advancements? LASIK versus smile. Which surgery is best suited for you? Let's find out. Center for Sight has transformed the landscape of eye care in the past 3 decades. Today, they have more than 85 centers across 16 states serving more than 12 lakh patients every year. यहाँ 350 से ज्यादा expert eye surgeons हैं offering treatments to cure cataract, retina, glaucoma, cornea and pediatric eye issues. Modern surgeries like LASIK, Smile and Silk से लेकर in-house optical and pharmacy support तक. They also have fun interactive eye testing activities. You really have everything here under one roof. What is this? 7-ish. This got some mix of numbers.
This is THIS. This message.
Green, yellow, red, black, green, blue. This is tough. तो सबसे पहले तो ये जानना चाहूँगी कि हम सब अपनी आँखों का ध्यान नेचुरली कैसे रख सकते हैं?
एक तो जो स्क्रीन टाइम हम यूज़ कर रहे हैं वो कम करना बहुत ज़रूरी है. टुडे इफ़ यू सी इवन छोटे छोटे बच्चों से लेके बूढ़े तक सब अपने फ़ोन से ग्लूड रहते हैं. एक आधा नाइस पॉडकास्ट और समथिंग दैट यू हैव इंटरव्यूड वो कुछ देख ले ठीक है, लेकिन पूरे दिन सब चीज़ देखना आई थिंक इट इज़ कॉजिंग अ लॉट ऑफ प्रॉब्लम टू द आइज़. तो पहले तो स्क्रीन टाइम को लिमिट करना है. एंड सेकेंड मोस्ट इम्पॉर्टेंट कि अगर आप यू कांट हेल्प इट बिकॉज योर प्रोफेशन इन्वॉल्व्स कि आप स्क्रीन पे हो. फ़ोन देखना पड़ता है, आईपैड देखना पड़ता है, लैपटॉप देखना पड़ता है, योर प्रोफेशन डिमांड्स इट. अगर ये ज़रूरी है तो फॉलो द 20-20-20 रूल. एवरी 20 मिनट्स 20 सेकेंड्स का ब्रेक लेके 20 फीट दूर देखना है. 20 फीट मीनिंग माप के नहीं, दूर जितना देख सको. एंड ब्लिंक एज मच एज पॉसिबल. दैट विल गिव रेस्ट टू द आई. दैट विल ऑल्सो गिव अकोमोडेशन अ चांस टू रिलैक्स. तो आपका जो नंबर है वो बहुत जल्दी नहीं बढ़ेगा. और जो ड्राई आइज हो रही है जिसकी वजह से आपको इतनी दिक्कत हो रही है वो कम हो जाएगी. बिल्कुल. एंड इफ़ इन केस कुछ भी प्रॉब्लम सा लगे तो कॉन्टैक्ट योर डॉक्टर इमीडिएटली. डोंट वेट फॉर टू लॉन्ग.
स्क्रीन को छोड़ना मुश्किल है. इट्स बिकम लाइक अ न्यू नॉर्मल, पार्ट ऑफ आवर लाइफ, पार्ट ऑफ आवर बॉडी, स्किन, एवरीथिंग, राइट? नाउ व्हाइल वी आर लिविंग विद द डिजिटल स्क्रीन्स, is there any suggestions around how can we still protect our eyes? Is it any mode, dark mode, white mode?
So those
screen
modes,
time कितने घंटे हो तो ठीक है, you know?
So those modes depend upon what is the lighting condition. If you are in good light, then it's okay to just go for a normal mode. Otherwise, go for dark mode if there is going to be less illumination around. And whatever your eyes can sustain. आपकी आँख बोल सकती है, आपको खाली सुनना है. तो लिसन टू योर आइज आर टेलिंग यू कि बस सब बस हो गया एंड स्टॉप. ठीक है, वो आपकी मम्मी नहीं है कि आप नहीं सुनोगे चलेगा.
Right. But have you seen, doctor, spike in the number of cases that you are getting over the last few years?
Absolutely.
Because you've been in the industry for so long.
In fact, according to an estimate, by 2050, there are going to be 50% of people needing to wear glasses. That's a big epidemic. Yeah. It's actually a cause for concern. Because नंबर होना एक बात है कि आप चश्मा पहन के देख सकते हो, पर नंबर की वजह से जो दूसरे मायोपिक कंडीशन की वजह से retinal weakness, degeneration and quality of vision deteriorating, ये bigger issue है. Myopia per se is a disease एंड उससे आँख खराब होती है और वो हमें प्रिवेंट करना है.
राइट. सो इफ़ यू कैन ब्रेक इट डाउन फॉर मी, मायोपिया फ्रॉम व्हाट आई अंडरस्टूड ज़्यादातर बच्चों को होता है, बड़ों को होता है, इज़ देयर अ एज ग्रुप, और कैसे हम डिटेक्ट कर सकते हैं कि हमें मायोपिया है?
व्हाट इज़ मायोपिया? जब कॉर्निया की कर्वेचर एंड द लेंस कर्वेचर जो रेस को बेंड करती है वो रेटिना तक पहुंचा नहीं सकती है, तो आपको मायोपिया बोला जाता है. इट्स फॉलिंग शॉर्ट ऑफ रेटिना. ठीक है, तो उसको वो पॉइंट को रेटिना पे फोकस करने के लिए आपको माइनस नंबर लगाने पड़ते हैं जो आपके रेस को एग्जैक्टली रेटिना पे फोकस कर सके. सो इट डिपेंड्स डायरेक्टली ऑन द साइज ऑफ द आई बॉल. जैसे आप बड़े होते हो, हाइट इंक्रीज होती है, वैसे शरीर के दूसरे अंग की तरह आँख की लंबाई भी बढ़ती है और ये पॉइंट दूर दूर चला जाता है, इसलिए नंबर्स बढ़ते जाते हैं. इसलिए देयर आर स्पेशल ड्रॉप्स दैट वी गिव टू किड्स जिससे कि ये बहुत ना बढ़े, एंड देयर आर आल्सो स्पेशल ग्लासेस विद पेरिफेरल डीफोकस जिससे कि ये लंबाई बढ़नी लिमिटेड हो जाए, तो आपका नंबर बहुत नहीं बढ़ेगा.
राइट. ओके. ऑफ कोर्स नंबर बढ़ने से आपकी विजन तो कम होती है, बट लाइक यू मेंशन ब्रेन का डेवलपमेंट टू इट्स फुल पोटेंशियल वो नहीं हो पाता. सेल्फ कॉन्फिडेंस,
Yes,
you know,
that is the biggest thing. Your self-confidence goes down because you can't see clearly. You always feel limited. ठीक है.
Yeah.
अगर आप आँख से आँख मिला के अगर बात नहीं कर सकते, स्पेशली इफ़ यू आर अ सिंगर, इफ़ यू आर परफॉर्मिंग एंड यू कांट सी your audience's reaction, it affects your performance. You have to be able to connect.
Absolutely.
और connection के लिए आँख is the first thing.
Right.
Because unless you can see, you cannot connect.
So you did your college from Mumbai?
From Mumbai. Everything from Mumbai.
Born and brought up in
Born,
Mumbai?
brought up, everything only South Mumbai. I have not gone beyond Worli.
You're a sobo girl.
Totally a sobo girl.
Okay.
And I never ever thought I'll land up in Vadodara.
Okay.
I didn't know what to do because I didn't know a soul here except my husband. But I was very lucky to have the best parents-in-law and the best husband. They were very supportive. I started working in a charitable hospital here so that at least, I would get patients and I would get familiar with the surrounding and all. My husband is an entrepreneur. They used to deal with medical equipments and they used to sell ophthalmic lasers. That laser was giving a lot of troubles, so he had to go to Germany for training. He's an engineer, he's an IIT graduate. So he went for training, but he also looked around to see. And at that time, lasers were absolutely new in the whole world. So in US, they were not even having any lasers.
Right.
He visited several practices and all and came back and he said, we'll start a chain of laser clinics. We'll put up 100 of that.
Wow.
And I said, I said, are you crazy? As soon as I delivered, I went to Germany for training.
Okay.
And training was just observation, but I came back with some knowledge. And we invested in a laser by taking loans and taking help from family and also. The first center, the bank people said that you should start in Bombay. We stayed with my mother with a small baby,
Right.
3 of us with my mother for 1.5 years and tried to run that center in Bombay. For the first 3 months, we had 3 patients, all free of charge and all like known to the staff or the people we knew.
Yeah.
So it was like a total disaster, and the moment we had to pay the hafta, we were like really scared. They gave a fantastic article in Chitralekha, a 4-page one with a colored photograph of me operating on a laser on the front page.
Wow. Okay.
And it was like, it was a beautiful article, and then there was no looking back. While we were seeing hardly 10-15 patients in a month, it directly went on to 175-200 patients a month. And we started operating and learning and getting more and more experience, and it really went through. And when we came to Baroda the next year, on the first day we didn't even have a vision chart, but we booked 3 patients for surgery. So it was that good. but we really worked for it. So we then set up centers every year in different cities. So after Baroda, it was Ahmedabad, then Rajkot, Porbandar, then Surat, and we did it in Andhra Pradesh, 3-4 centers. We did it in Kolkata, Udaipur. We like started spreading our wings and we started running those clinics pretty well. Then slowly it started gaining popularity and all our centers were doing pretty well. And then we merged our whole 22 clinics with Center for Sight.
Okay.
Almost 11 years back now.
Smile is the latest technology from what I understand. If you can break it down for us, Dr. Rupal, what is the difference and how is it that you were able to bring these technologies to India, being a pioneer in this space, that today you are actually called the mother of smile?
Because we started doing laser procedures early on in life, from 94, we had gained a lot of experience into corneal refractive surgery. And corneal refractive surgery is done in several different ways. It started by doing a surface ablation, where we would remove the skin-like layer of the cornea and doing a laser procedure inside and allowing the skin to reform. This is known as surface ablation.
Okay.
After that, because it was a little painful and a slower healing response and needed more care, LASIK came into being, where we started creating a small thin flap and doing the laser treatment underneath. So cornea is like a 500 pages notebook. So we used to open about 100 to 120 microns, do the laser treatment, put the flap back. Now we were using a blade to open this flap. And because it was a mechanical instrument called microkeratome, sometimes it would fail and not make it nicely. Right. And therefore femtosecond lasers came into being, where femtosecond lasers were used to create a flap and excimer laser to create the bed. Now it was too expensive a proposition to use a laser only to create a flap.
Right.
So Carl Zeiss as a company gave a lot of thought to it, and their physicists could actually work out a way where you can carve out a lenticule inside the cornea in an intact cornea without creating a flap. And this lenticule, a small piece of the cornea, could easily be removed through a small incision. That's why the name SMILE. Small, SM, incision, I, lenticule extraction. That's why SMILE.
Would you say LASIK now is a thing of a past and SMILE is the new thing, how one can get their eyes corrected?
So if your eye is suitable for a laser refractive surgery, I would say that SMILE probably holds the first place, because it is combining the best of surface ablation and LASIK. And it has a quick recovery of LASIK but without a flap. So it's like combining the best of both worlds, and therefore I think SMILE or SMILE-like procedures, lenticule-based procedures, are going to be the future.
Right.
The only prohibiting or limiting factor today is that it is not able to do plus number treatments well, and it has it's also expensive, because
more expensive
than LASIK would be. You would be surprised to know that girls today still are sent back for getting this corrected by their parents from their in-laws, and they discover it only later that they were wearing glasses. So two things going wrong, that the parents are hiding the fact that the girl needs to wear glasses, and the in-laws are sending them back saying that you get it done by your parent, otherwise we won't accept you.
This is happening.
This is happening even today, and not just in remote areas. It's happening in main cities also. It's really painful for me to tell you this. And as a girl or as a woman, it's an insult to womanhood that we still need to resort. But this is also an indication for getting corneal refractive surgery done, which is a pity. Right. Because the indications for corneal refractive surgery should be that you can get better quality of vision, you get freedom from glasses, it makes you feel happy, it makes you look happy and good, and it helps in so many professions, like if you are in contact sports, if you are a cricketer, if you are an actor.
Of course.
It can give you so much freedom if you are not dependent on glasses.
Right. But you know, when you talk about profession, I know when I was working as a news anchor, and we always have a teleprompter where we have to read the news.
That's
and I couldn't
also
read very clearly because I wanted to avoid wearing glasses, and I thought it was too painful to wear lenses.
Absolutely.
Right? But
that's one of the profession which actually requires you
yeah.
to, and you are actually a good candidate for refractive surgery then.
Right.
Because the indication is correct.
Absolutely. Okay, so how many eyes have you corrected in a day?
Okay, so
or overall?
Or overall,
yeah.
I've actually lost count. For the first 100 eyes, I was counting every single day. Then it was like once a month, once a year, and now I've stopped counting it since a long time.
Okay.
It's been 30 plus long years. I hate to mention that because it gives away my age. But
it talks about your experience and the precision with which you work.
But it must be close to a lakh or so.
Wow. Close to 1 lakh eyes corrected, right?
And more than that, I'm more happy about the fact that I could train more than 2,000 ophthalmologists from all across the world into this particular procedure. So they've done that first LASIK or smile with me. And I'm very happy and proud about, and as happy and proud as being the mother of smile. I'm happy that I could actually give back to the society.
So where do Indian doctors today stack up when you compare it to the world?
So just as I told you about smile, we were the first people to do it in the world. The silk, which is also lenticle-based procedure for the corneal refractive surgery, the first silk was done in India by Padma Shri Professor Mahipal Sachdev, who is also the chairman of the Center for Sight. The first silk procedures were also done in India in the world.
Wow,
so we are really
leading.
Yeah, we are really leading in that sense.
Wow. Smile and silk is something new and I haven't heard of. While you do mention about it being more expensive, I want to know if I'm paying those extra dollars, what is it that I'm going to get in return? What are the advantages of both of these procedures that you talk about?
What does it mean to the patient? Patient gets a bladeless, painless, flapless procedure where the vision recovery is almost instantaneous. So next day they go back to work.
Literally next day.
Literally, and they don't need to care much because there are no moving parts there. So if you create a flap, then you may need to take care for a month not to rub your eyes and not to go in areas where there would be any dust, wind. If you want to get married in a week's time, which happens quite often now, boys come from abroad and you meet and then you get married. I hear that a lot. I don't know how people manage it, but they do. And if you want to apply eye makeup, you can actually do that because you are
immediately after an eye surgery.
So after a week or 10 days, you can go ahead and even apply eye makeup, which you needed to wait for the flap to heal. So it's a big advantage.
Unclear vision is one, but what about blindness or squinting? These issues can also be resolved through surgeries?
So it depends upon the cause of blindness. So if the cause of blindness is cornea related, so cornea is like the glass of a watch. If your glass is bad, but the watch is functioning, then we can actually change the glass. And the glass which we are getting is from somebody else who donates their eye. Okay. So when you do an eye donation, it's actually this glass which gets used, only the cornea and not really the entire eye, even though we take the whole eye, right? Then by replacing the cornea with somebody who has donated the cornea, with that cornea, a person can see. So you can actually give vision to somebody who is blind. And so I would actually take this opportunity and this platform to urge everybody to pledge their eyes for eye donation, because after your life, this is the best gift that you can live for the world.
Right. And what is the procedure to donate your eyes? I think that
so
is
you should be knowing which eye bank is there in your area and give the numbers to your next of kin. So whoever you know, your family members at least should know, or you can even put it up on your fridge that this is the number to contact in case of eye donation. And You can just contact that number. Somebody comes and picks up the eye from your home.
Right.
But it should be done as quickly as possible after the death of a person.
Right. And what if you have a little bit of number, vision problem, cataract?
Even if you've been operated, or if you had numbers, and if you didn't have any systemic condition which is of communicable nature, like HIV, or if you had say hepatitis or things like that, then you are rejected. But otherwise, every tissue is getting used in some way or the other. In India, we are lacking and we are really having more patients who need corneal transplantation as compared to the donations that we are getting. So I would really urge everybody to please donate your eyes.
Wow, that's such a valid point, and one never thinks about it. But
yes,
I think the point that you've raised and made a pledge, I'm sure a lot of our subscribers are definitely going to do that and find out more about the eye bank in and around
that would
their
be
neighborhood.
worth all this effort.
Absolutely. Great. What are the other kind of reasons because of which your eye vision can be impacted? What about diabetes? Does that really impact?
You have actually raised a very, very pertinent question. Diabetes again is becoming almost like an epidemic, especially in regions like Gujarat.
Where everybody loves to have sweet food, is that?
Because everybody has to maintain their sweetness.
Right, that's another.
You'll find Gujarati people to be the sweetest people.
Yeah.
They are actually quite mild. They are sweet. They are interested in their business, and they are not really interested in the food.
Yeah,
and that's why they also suffer. Also genetic reasons, but mainly the food habits and all. And diabetes has a lot of effect on the eye. Plus, eyes can act as a window to your body. So we have in fact been able to diagnose diabetes for the first time looking into the eye.
Really?
Yes, because you can see the retina. When we look with an ophthalmoscope, we can see the retina and we can actually visualize the blood vessels. Which in the other parts of the body you would have to dissect to look at, or put in a dye or take pictures or something. Here you can actually see the blood vessels, and if there are diabetic conditions, and if there is diabetic retinopathy, it is actually mirroring what is happening in the entire body.
What about flickering of eyes? They say अगर दाई आँख फड़क रही हो कुछ अच्छा होने वाला है या ये तो is there some logic? And of course all of that is superstition, but I want to just understand scientifically or medically what is the sign?
Flickering occurs mainly if there is a deficiency of vitamins and minerals in the body or fluid in the body. हम RO water बहुत पीते हैं and minerals are lacking in those water. So if you can have more fluid, especially जब summer time होता है, when we are very young, at that time if you can give food which are rich in vitamin A, that helps in the development of the small children's eyes.
Right.
So you should give more carrots, more red fruits, right? That can lead to and a lot of green vegetables. Of course, it's like easier said than done. I know mothers are like really fretting because they can't just have their children eat certain things that they want them to eat. So you have to be imaginative. I used to make my own make the tiffin for my children, and I used to add in everything that I would put in the box, I would add some vegetables in some disguised form. That would work.
We also hear of flax seeds or fish, which are omega-3 rich foods, right?
I think they are really good food, and if you can incorporate in your diet, it would be really working well.
Doctor, your hospital really looks very, very fancy, and I love your cabin circular right in the middle of the hospital. So what are the kind of facilities that you have around here? And
so we have a comprehensive eye hospital here, where we have all the departments working under one roof, and the departments where we don't have many patients, like oculoplastics, neuro-ophthal, where there are not many patients in a second-tier city like this. We have a telecommunication. So we, the doctors who are the experts in India and abroad are on our panel. So we do telecommunication with the patients, with them. All the tests are possible. We have advanced technology to diagnose glaucoma, cataracts, of course laser refractive surgery, which is our main thing. All the other common conditions are getting tackled in here itself.
And what happens if you don't correct cataract?
So it's one of the most preventable cause of blindness today.
Really? Okay.
So it's something that is the most treatable cause of blindness, I should say.
Okay.
Cataracts usually are age related. So you have the beginning around 60, 65 years of age, and they progress, and you would require surgery between say 50 to 70 years of age.
Okay.
If you have diabetes, if you are a juvenile diabetic, then you can have a cataract developing at a very early age. And sometimes it's genetic, so your father or your mother had an early cataract and you also develop it early. Okay. So when you get rid of your cataract, you can also along with that get rid of your glasses. Okay. So it has developed to that extent where not only you get clear vision but also you can be free of glasses. Okay. And this is possible because now we do cataract surgery through a very small incision. Okay. So we are not inducing much cylinder error. You go through a minimal small incision, you go in with a probe and you make the cataract into a pulp. There are lenses now which are correcting your vision for all distances, including distance, intermediate and near. So if you are a fit candidate for that, we suggest you to put those lenses which can get rid of your glasses also. Amazing. So now cataract surgery has become almost like a refractive surgery.
And the recovery is very quick.
Very good and very quick. You do need to take more care than in a refractive surgery. So you, for at least a month or so, you need to put drops. You need to be going for checkups. And for at least 10-15 days, we don't allow you to take water on your eyes. Okay. But you are able to see from very next day, so you can actually read, write, work on computers, you can drive and resume your normal activities within a couple of days.
So we often talk about how we need a little bit of sunlight for our eyes, but what about wearing goggles in the sunlight? Is that a good thing, bad thing? What is it that you want to say about sunglasses?
So, if you are going out in the sun, it's good to wear UV protective glasses, especially in our sorts of country, because the UV rays are quite harmful to our lens and the macula. So you can get early cataracts if you are going out in the sun a lot and working in sunlight a lot. So you should be wearing UV protective glasses, and they also increase your fashion quotient. So
why not?
Why not?
I'm sure this interaction of ours has been very, very helpful for all our viewers here, and I'm sure they have learned a lot. Thank you so much, Doctor.
It was such a pleasure, Kamiya.
Follow Center for Sight and post your queries to get answers from the experts.